This video may save you from a $15,000 mistake. Right now, there are men over 40 training hard, feeling strong, while slowly tearing down their shoulders, their knees, and their spine 1 rep at a time. It doesn't happen suddenly. It starts as a small discomfort, a tight shoulder, a stiff knee, a lower back that just feels off. You ignore it. And then one day, something gives. And now you're not training. You're in rehab. Or worse, surgery. After 40, your body is no longer forgiving. Collagen production drops. Joint lubrication decreases. Recovery slows down. And the exercises that once built your body can now quietly destroy it. In this video, I will show you 11 exercises every man over 40 should seriously reconsider. And more importantly, what to do instead. Stay until the end. Because exercise number 5 is responsible for more injuries than almost anything else in the gym. Let's begin. 1. The dumbbell fly. This movement looks controlled, but it places your shoulder in its most vulnerable position under load. At the bottom, your rotator cuff is stretched and forced to stabilize weight. It was never designed to handle at that angle. After 40, reduced blood flow and tendon elasticity make this position extremely dangerous. 1 bad rep can mean months of recovery. Replace it with machine fly or cable crossover. You still train the chest, but remove the unstable, high-risk leverage. 2. Front raises. Most people don't need front raises. Your anterior deltoid is already heavily activated in pressing movements. Adding more volume here only increases stress on the shoulder joint. Worse, this motion often causes the biceps tendon to grind under the acromion. Over time, that becomes chronic inflammation. Instead, use a controlled dumbbell press. More load, better mechanics, less damage. 3. Upright row. This is one of the most problematic movements for shoulder health. You are lifting your elbows high while internally rotating the shoulder, a perfect setup for impingement. Tendons get compressed. Bursa gets inflamed. Mobility disappears. And once shoulder impingement starts, it rarely goes away quickly. Switch to shrugs and controlled lateral raises. You build size without sacrificing function. 4. Leg press. The leg press feels safe, but that is exactly why it's dangerous. As the weight increases, your lower back begins to round against the pad. Now your spine is under massive pressure in a compromised position. This is how disc injuries happen. And after 40, discs don't recover easily. Instead, use goblet squats or controlled barbell squats. More natural movement. Better core engagement. Safer long-term. 5. Barbell bench press. This is the most overrated and most abused exercise in the gym. Not because it's bad, but because of how people use it. Heavy loads, fixed grip, poor shoulder positioning. All of this shifts stress away from the chest and directly into the shoulders and tendons. This is why so many PC tears and shoulder injuries happen here. Switch to dumbbells. Your joints move naturally. Your muscles work harder. And your risk drops significantly. 6. Behind the neck press. This is an outdated movement that forces your shoulders into extreme rotation. Most men over 40 simply do not have the mobility to perform this safely. The result? Joint stress. Neck strain. Rotator cuff damage. Press in front of your body instead. Same muscles, far less risk. 7. Bent over barbell row. This exercise demands strong spinal stability. But fatigue changes everything. As soon as your lower back rounds, your discs take the load. And with age, those discs are far less resilient. One mistake here can stay with you for life. Use a chest-supported row or seated cable row. You still train your back without gambling your spine. 8. Traditional sit-ups. They look simple. But repeated spinal flexion under load compresses your discs over and over again. Add in poor form, pulling your neck using momentum, and you create long-term damage. Replace them with planks. You build a strong core that actually protects your spine. 9. Behind the neck lat. Pull down. There is no benefit here that you cannot get from the front variation. But there is significantly more risk. Your shoulders are forced into a weak position. Your neck compensates. And over time, this leads to joint irritation and reduced mobility. Pull to the front. Stay upright. Stay safe. 10. Romanian deadlift. This is a precision movement. But most people perform it with poor flexibility and excessive weight. The result is simple. Your hamstrings stop doing the work. Your lower back takes over. And that is where injuries begin. Use controlled deadlifts or reduce the range of motion. Protect your spine first. Train second. 11. Diamond push-ups. This position places extreme stress on your wrists and elbows. Instead of loading the triceps effectively, you overload small joints. Over time, this leads to tendinitis. And once that happens, even basic pressing becomes painful. Use rope tricep extensions. Better isolation. Better joint alignment. Zero unnecessary strain. After 40, training is no longer about proving strength. It's about preserving it. The goal is not just to build muscle, but to keep your body functional for decades. Remove the wrong exercises and everything changes. But remember, exercise is only half the equation. If you don't recover properly, you will still break down. And that is exactly what we will fix next. Iron Protocol.